This video will cover ELOC mutated renal cell carcinoma. To anchor ourselves, let's first notice our main character, the crab. Crab is a universal symbol for carcinoma, or cancer, right? And notice how the crab is locked within this cage, or you could even call it a cell. But this is not just an ordinary lock, it's an electronic lock, or you could even shorten it to ELOC. Putting these elements together, we're going to remember that this video covers ELOC mutated RCC. Let's move on to some histology findings. These tumors often are nodular with thick transecting fibromuscular bands. I think you know where I'm going with this. Look at our character here with all these nodules on his skin. Not only that, but this guy is muscular. The next thing to notice about this guy is his toga. Just like how these tumors show transecting bands, his outfit is kind of transecting across his chest, right? Another histologic finding is voluminous clear cytoplasm with prominent cell borders. Well, this will be represented by simply the fact that our main character is contained within this clear cage or cell. Next thing to talk about is the staining pattern. These tumors stain positively with CD10, which is represented by this den in the background here that is full of CDs. A den full of CDs sounds like CD10. The next stain is a keratin stain, CK7, which is represented by this caret from heaven. Caret will represent keratin, and the number 7 is represented by the fact that this caret is from heaven, which sounds like 7. The last stain to discuss is CA9. I don't know if this is some kind of festival, picnic, or whatever, but there's a large banner here that states CA9 complete. This represents the positive staining with CA9 in these tumors with a complete membrane pattern. Lastly, all these characters look happy and just vibing. This represents the fact that these tumors are generally indolent.